Hi, my name is Emily Sweeney, and I'm a pediatric sports medicine physician at Children's Hospital Colorado and the University of Colorado. I'm also a former gymnast, coach, and judge, so I'm excited to talk about some common injuries we see in gymnastics athletes. Injuries in gymnastics include common acute problems like fractures, ankle sprains, and ACL tears. However, this presentation is going to focus on the more unique overuse injuries that gymnasts sustain, like gymnast wrists, elbow OCDs, spondylolysis, severs, and anterior ankle impingement. First, I will review a few upper extremity injuries that occur in gymnasts. Gymnast wrists is an overuse condition that affects the distal radius. Because gymnasts use their hands like legs when they tumble and do handstands, they can develop gymnast wrist, which is a stress fracture of the distal radial physis. On exam, patients typically have tenderness over the distal radius and limited wrist extension. Having a gymnast try to lift themselves off the exam table will often recreate their pain. Early on, x-rays may be normal, but as the condition progresses, x-rays may show widening and irregularity at the growth plate. Gymnasts will need a period of time in a cast or brace to allow the wrist to rest, and then physical therapy. Often there is weakness or tightness in the shoulders or upper back that can contribute to this issue, which is something PT can help address. Next up is elbow OCD, or osteochondritis dissecans. This is an overuse injury to the subchondral bone and cartilage, often at the capitellum. Gymnasts may present with a slight loss of elbow motion or mechanical symptoms like catching or locking. OCDs are often found on x-ray, but usually need an MRI to determine the best treatment plan. This may involve a period of bracing or casting, or it may mean surgery followed by physical therapy. Moving to the spine, we often see gymnasts with spondylolysis, which is a stress fracture of the pars interarticularis, a small portion of the spine. Gymnasts usually have low back pain with arching or tumbling. You may be able to see the stress fracture on x-ray, but most of the time an MRI is needed to see the abnormality. Treatment consists of a period of rest and physical therapy. It can take anywhere from 2 to 6 months to get back to gymnastics after this injury. In the lower extremity, severs is an overuse condition that commonly occurs in kids age 8 to 13. Severs is also known as calcaneal apophysitis. The gastrocnemius and soleus form the Achilles tendon, which inserts on the calcaneal growth plate. When a gymnast runs and tumbles, the tendon pulls on the growth plate, and the impact of gymnastics causes pain at the growth plate. Sometimes I describe this injury as the kid version of Achilles tendonitis. For athletes who wear shoes, heel cups in all their shoes and cleats can be helpful. But for barefoot athletes like gymnasts, I usually recommend the cheetah heel cup or the X-brace while doing gymnastics. In addition, gentle stretching, ice, and avoiding painful activities can be helpful. Finally, anterior ankle impingement is an overuse injury we see often in teenage gymnasts who have sustained repeated ankle injuries or who have landed short or in dorsiflexion. This sometimes leads to bony impingement, but more often there is pinching of the anterior soft tissues of the ankle. Diagnosis is often based on history and exam. Occasionally, bony changes will be noted on x-ray, or soft tissue edema will be seen on MRI. Treatment can be tricky and often involves a period of limiting high-impact skills, anti-inflammatory medications, physical therapy, and occasionally injections or surgery. For any of these conditions, it's often helpful to involve a qualified physical therapist in helping you progress back to gymnastics. Not everyone is a gymnastics expert, and that's okay. In Colorado, we created body part-specific gymnastics return to sport progressions. So if you have a wrist injury, for example, you can use this as a guide to help you progress back to doing all your skills in the gym in a safe and stepwise progression. These progressions have been published and are online, as well as in the journal Current Sports Medicine Reports. Because gymnasts often have many overuse injuries, it's important to recognize some ways to decrease the risk of these problems. The first is making sure you don't ignore pain. Addressing a problem earlier will lead to faster recovery. Second, it can be very helpful to be aware of the gymnast's training hours. A general rule of thumb is to not train more hours per week than years in age. However, some gymnasts train twice this amount. Therefore, it may be wise to take breaks during the year or take a few days off if you are having pain, feeling sore, or if you start to feel burnt out. Finally, having adequate nutrition and recovery is key. Seeing a sports dietitian can help ensure you are eating enough and eating the right foods. Overall, for any gymnastics injury, it's important to make sure you have clear, honest communication between the gymnast, parent, medical team, and coaches. For more questions, or if you have any other concerns, please reach out to our team.